Hi, I'm Dr. Matt Rasmussen with Periodontics and Implant Dentistry of Tallahassee. We've been getting a lot of questions regarding clinical crown lengthening, so I wanted to go through some of the most common questions with you on a quick video today. Clinical crown lengthening is a procedure where we lengthen the tooth to give an opportunity for more of the tooth structure to be exposed. This can be done sometimes for aesthetic purposes so that an area looks nicer, but most commonly is done to allow additional structure of the tooth to be exposed so that an additional crown can be placed later. Clinical crown lengthening can be done anytime that a dentist needs more room on the tooth to be able to get the portion and pieces needed for them to be placed later. So if a crown needs to be placed and there's not enough room, then they'll recommend crown lengthening. This can be done when a tooth is cracked. It can be done when a cavity is on the tooth or any other consideration that allows where we need more tooth structure. Clinical crown lengthening is an important procedure because anytime we can save a tooth is always the best option. Of course, there are options to replace a tooth when it's not there, like a dental implant or other options available, but none of those options are as good as someone's natural tooth. So the goal of clinical crown lengthening is to make sure that we save the tooth. Clinical crown lengthening is a relatively minimally invasive procedure. It is technically dental surgery, but it's something that's going to be done just with regular anesthetic numbing like you would for any other major dental procedure. The gums are open in the area, allowing us to expose the area. We smooth any areas that need to be smoothed. We just close the area so then the areas can heal. Then any additional work can be done by your dentist. Clinical crown lengthening is a relatively minimally invasive procedure, and the downtime afterwards is relatively minor. Many patients report limited discomfort or minimal discomfort with pain medication afterwards. We'll always see the patient 2 weeks after the procedure to remove any sutures remaining, and we do want to give the gum tissue time to settle before the doctor does any additional work such as a crown or a filling near that area. Clinical crown lengthening is a procedure that, once done, is a completed result. There's no likelihood of recurrence of the procedure needing to be done again. However, for some reason, crown lengthening needs to be done in a different area at a different time. Of course, that's a different area. Any tooth that has some type of prosthesis, whether it be a filling sitting inside of the tooth or a crown sitting on top of the tooth, still has part of the remaining tooth structure exposed. So it's important for the patients to come in for regular maintenance visits afterwards because cavities can recur around results from another procedure having been performed. That includes clinical crown lengthening. Clinical crown lengthening is a procedure that does indeed carry a cost. Many patients have dental insurance, so I'd like to address that first. This is a procedure that oftentimes is a covered benefit under dental insurance. However, it's always important for us to verify benefits to see what type of coverage is available for that particular procedure. Now, in addition to the insurance portion of the financing, we do have options available for financing for any significant procedure. For a procedure such as crown lengthening on one tooth, patients may be able to pay for that all at once. But remember, we do have third-party financing options available, and we need to spread payments out over a period of time. If you're ready to talk about clinical crown lengthening, please feel free to give us a call at area code 850-692-9200. We can set you up for an exam with or without a referral and see you here soon for an exam. Look forward to meeting you then.